An 82-year-old York man became the first in the nation to test out a new heart device. Doctors at York Hospital inserted the device, and they believe many people who suffer with atrial fibrillation could use it someday. CBS 21's Donna Kirker-Morgan is with the York County Mobile Newsroom in York to show us what the device does.
It was the first device implanted in the country, a device that helps out with the little sac that apparently all of us have on our heart. It's very critical when we're embryos, but can cause big trouble when we get older and we have heart problems.
They actually pass through the center of the heart.
Dr. William Nicholson showed us how the device is put into position with a catheter that is threaded to the heart through a leg vein.
When we're happy with the positioning of the device, we just unscrew it down at the leg and release the device.
A tiny little mesh device that expands, closing off the arterial appendage, a pouch that can cause real trouble for people with irregular heartbeats.
Blood doesn't get pumped aggressively through the heart, it stagnates, and when it does that, it wants to clot. Over 90% of these clots form in that little pouch.
For decades, doctors dealt with the clotting by prescribing blood thinners like Coumadin, but thinners mean constant screening and fear of bleeding for patients.
If I had to get a tooth pulled, or if I was shaving and would cut myself and my blood would be too thin, it would be hard to stop.
82-year-old Jack Stottlemyre of York didn't want to have his picture taken, so we talked by phone about his choice to be the first in the country to try the treatment.
Didn't feel any different. I just wanted it done.
Now, Jack might have been the first in the U.S., but he's not going to be the last. As a matter of fact, 100 other people in York County may be part of the clinical trial of this device. If all goes well, it could become part of everyday medicine in 4 to 5 years. With the York County Mobile Newsroom in York, Donna Kirker-Morgan, CBS 21.